welcome back to my channel. Today I am going to talk about BTL EMSELLA. So I went to try it today. So I'm already here. I'm gonna try the machine. This is how it looks like, and this is the chair. I am excited, and let's see how it feels. I am done. I did it for 28 minutes. I just think that this machine is really good. I mean, this is super innovative, and it can really help a lot of women when it comes to incontinence after giving birth. And for all of you who doesn't know BTL EMSELLA, BTL is a well-known and well-respected European manufacturer of medical equipments. So EMSELLA means electromagnetic chair. M, electromagnetic, and cella came from the Latin word cilia, which is chair. So in short, it's electromagnetic chair. So BTL EMSELLA works on the principle of patented HIFEM, which is HIFEM, a high-intensity focused electromagnetic technology. So HIFEM is an extremely focused electromagnetic field, and it's a high intensity enables to reach supramaximal muscle contractions while patient sits comfortably on the EMSELLA chair. So EMSELLA is an FDA approved machine or treatment specifically for pelvic floor muscle to treat incontinence. So there are three types of incontinence, or three types of urinary incontinence. Or first is the stress urinary incontinence, which is associated with activities increasing intra-abdominal pressure. Example, coughing and laughing. Urge incontinence is, it involves involuntary loss of urine, which occurs when a person has a strong sudden need to urinate. Mixed urinary incontinence involves symptoms of stress and urge urinary incontinence. Now, urinary incontinence or UI is an involuntary leakage of urine caused by aging, vaginal delivery, menopause, and other causes. So, postpartum and postmenopausal women represents the largest population to have UI or urinary incontinence. Because our pelvic floor muscle muscles are responsible for the control of continence and body aging, childbirth, and menopause, contribute to pelvic floor muscle deconditioning and development of incontinence. Therefore, effective treatment of incontinence requires pelvic floor muscle re-education. Or what are the functions of pelvic floor muscle? So there is 5 functions of pelvic floor muscle. Number 1 is organ support. Pelvic floor muscle supports the bladder, uterus, rectum, and abdominal organs against gravity and downward pressure. Strengthening the pelvic floor muscles helps improve organ support and return organs to better positions to prevent incontinence and prolapse. Number 2 is stability. The pelvic floor helps stabilize our pelvis and lower back. So, strengthening this muscle will improve our core stability. And number 3, sphincteric function. Muscles of pelvic floor that controls the opening of the urethra where urine comes out, and the rectum where the feces comes out. The pelvic floor muscles prevent leakage of urine and feces and gas. Number 5 is sexual function. Pelvic floor muscle plays a big role in organs and helps maintain erection for men. Improved pelvic floor muscles improve sexual functioning. Next one is the circulation. The pelvic floor muscle acts as a scump pump to help pump blood back up towards the heart. This leads to improved circulation in the pelvis and better cardiac return. So as I said, BTL EMSELLA uses a high-frequency focused electromagnetic technology to cause deep pelvic floor muscle stimulation or stimulation of the entire pelvic floor area. So a single sessions using this machine will give you thousands of supramaximal pelvic floor muscle contractions, which are extremely important in muscle re-education of incontinent patients. So if you want to do the EMSELLA, you need to have at least 6 sessions. Some person needs at least 7 or 8 sessions or even 9. But usually you need to have at least 6 sessions complete for the treatment. The treatment duration is 28 minutes. And you can do the treatment 2 times in a week. You need to have leeway time for your pelvic floor muscle to rest before having another treatment. So 2 times in a week is already good. And the good thing about the treatment is that it is non-invasive. No downtime. You can do errands right after you do the treatment. You can even go to the gym after you do the treatment. You can do the treatment fully clothed. You can have your clothes on doing the treatment. And it is a walk-in and walk-out procedure. So contraindications using EMSELLA, that means you cannot use EMSELLA if you have cardiac procedure, implanted defibrillator, neurostimulator, electronic implant in your body, metal implant such as titanium joints, and copper IUD or drug pump, and others. So it's better not to use EMSELLA when you have metals in your body. So it also includes hemorrhagic conditions, anticoagulation therapy, if you are also using anticoagulants to thin or blood thinners, heart disorders, cancer or recent surgical procedure, as muscle contractions can disrupt the healing in the treatment area. You also cannot use EMSELLA if you are pregnant, you are nursing, or if you are a nursing woman. You cannot also use EMSELLA if you have a heavy period or heavy days or period, as this could lead to increased blood flow or bleeding and cramping. So how I felt during the treatment, there are periods of more intense pelvic floor contractions, and there are also periods of less contractions throughout the 28-minute cycle. The feeling of contraction depends, it's very subjective. Some women thinks like it's nothing, like it's okay. It is not painful, but for me it's not comfortable because there is I feel contraction on my pelvic floor. I don't have a good tolerance with pain. It's not painful, but you know, tolerance with, I don't know, someone will just poke me, it hurts already. So for me, it is okay. It's uncomfortable, but it's not painful. Yeah, throughout the 28 minutes, I sat there. I felt the contraction. The contraction feels like I giving birth. Like before I give birth, I felt the contraction. That's the contraction that I felt. After the treatment, I felt okay. I don't feel anything. It's like nothing happens. I don't feel any muscle contraction right after. What I felt is that when I sneeze, because usually when I sneeze or when I go to the gym doing kicking or something, or boxing, kicking, whatever, there is an involuntary leakage. So from that moment, after the treatment, usually they say you will see the result after 2 weeks of the first treatment. But mine, I already saw it right after the treatment. So I only did 1 time. I still have at least 5 times. So I think the result is really good. I am very happy with it. I think lots of women, EMSELLA already help lots of women having incontinence, and the reason why I am doing that session is because I already have a baby. Since I gave birth, I have incontinence, so it is not a pleasant thing to have. So yes, I have to finish 5 more sessions. So that's it, guys. That's my experience, and that is what BTL EMSELLA means. And I hope this video helped you a lot in understanding what BTL EMSELLA usually is and what it does to our pelvic floor muscles, and incontinence. So yes, guys, that's it. Thank you very much for watching this video. I hope you enjoyed it. Please give it a thumbs up and subscribe if you haven't done yet, and ring that bell for you to get notified in my upcoming videos. Thank you very much, and see you soon. Bye!